Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Ikmal bin WIRA. I study at University Kuala Lumpur, Malaysia French Institute. The course state is a Bachelor of Engineering Technology, Welding and Quality Inspection.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Azrul Akmal bin Muhammad SUKRI. I study at University Kuala Lumpur, Malaysian French Institute. My course is Bachelor of Engineering Technologies, Welding and Quality Inspection.
Assalamualaikum and hi everyone. My name is Muhammad HELMI bin ARIFIN. I am currently studying for Bachelor of Engineering Technology, Welding and Quality Inspection at UniKl MFI.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad ZIKRUL HAKIM bin ZAKARIA. I study at University Malaysian France Institute. My course Bachelor of Engineering Technology, Welding and Quality Inspection.
The Malaysian Psychiatric Association is a company that provides effective solutions to those with mental health problems, especially depression. Our company will try its best to help them overcome their mental health problems with our service so that they can live the life they deserve. We can also raise awareness among students to take a proactive about their environment so that they can help prevent this problem from getting worse. We will also describe a discussion of health problems and how to prevent them to meet anxiety to help any students suffering from mental health, especially depression, so that they can live a meaningful life again. What is depression? Depression or major depressive disorder is a common and serious medical illness that negatively affects how you feel, the way you think, and the way you act. Fortunately, it can also be treated. Depressive cause feelings or sadness or loss of interest in activities you once enjoyed. It can lead to a variety of emotional and physical problems and can reduce your ability to function at study, work, and at home. For most of us, they can seem like a decisions. It can seem like a depressed person has decided to be lazy and sleeps all day, or they have decided to stop spending time with a friends because they have a bad attitude. But remember, what is in our head is not an illusion. Our true feelings and behaviors are influenced by a series of complex chemicals in our brain. The exact cause of depression is poorly understood, but we have an idea of the factors that influence the disease. We know the change to hormones in the brain called neurotransmitter can have a big impact on depressions. Many medications used in the treatments of depressions work by increasing the levels of this neurotransmitter. We also know the genetics plays an important role in depressions. Treatment for depressions usually include psychotherapies and medications. Either can work on its own, but a combination of medications and therapy is found to be most effective. In short, depressive is a widespread but poorly understood disorders such as symptoms can negatively affect a person's thoughts, feelings, and behavior to a debilitating degree. However, treatments that include medications, psychotherapies, or a combination of both can help relieve these symptoms of depression.
Hello everyone, today we are going to be looking at some of the type of depression. I have stated 5 common type of depression, which are major depressive disorder, persistent depressive disorder, bipolar disorder, postpartum depression, and premenstrual dysphoric disorder. Firstly, we will talk about major depressive disorder. When people use the term clinical depression, they are generally referring to major depressive disorder, MDD. Major depressive disorder is a mood disorder characterized by a number of key features such as depressed mood, lack of interest in activity normally enjoyed, change in weight, change in sleep. Secondly, dysthymia, now known as persistent depressive disorder, PDD, refers to a type of chronic depression present for more days than not for at least 2 years. People might experience brief periods of not feeling depressed, but this relief of symptoms lasts for 2 months or less. While the symptoms are not as severe as major depressive disorder, they are pervasive and long-lasting. PDD symptoms include feeling of sadness, loss of interest and pleasure, anger and irritability, feeling of guilt. Next, bipolar disorder. Bipolar disorder is a mood disorder characterized by periods of abnormally elevated mood known as mania. This period can be mild or they can be so extreme as to cause marked impairment with a person's life, require hospitalization, or affect a person's sense of reality. The vast majority of those with bipolar disorder also have episodes of major depression. In addition to depressed mood and markedly diminished interest in activities, people with depression often have a range of physical and emotional symptoms which may include fatigue, insomnia and lethargy, unexplained edge, pains and psychomotor agitation, hopelessness and loss of self-esteem, irritability and anxiety, indecision and disorganization. Next, postpartum depression. Pregnancy can bring about significant hormonal shift that can be often affect a woman's mood. Depression can have its onset during pregnancy or following the birth of a child. Currently classified as depression with peripartum onset, postpartum depression PDD is more than that just the baby blues. Mood changes, anxiety, irritability and other symptoms are not uncommon after giving birth and often last up to weeks. PPD symptoms are more severe and long-lasting. Such symptoms can include low mood, feeling of sadness, severe mood swings, social withdrawal, trouble bonding with your baby, appetite change. Last but not least, premenstrual dysphoric disorder. Among the most common symptoms of premenstrual syndrome (PMS) are irritability, fatigue, anxiety, moodiness, bloating, increased appetite, food craving, edge, and breast tenderness. Premenstrual dysphoric disorder (PMDD) produce similar symptoms but those related to mood are more pronounced. PMDD symptoms may include extreme fatigue, feeling sad, hopeless, or self-critical, severe feelings of stress or anxiety, mood swings, often with bouts of crying. Thank you.
Let me tell you about the sign and symptom of depression. Firstly, sleep problem. With depression can reduce energy and motivation during the day. A student may often be awake at night, unable to sleep. On the other hand, some students with depression may find it difficult to get out of bed and may fall asleep for a long period during the day. Secondly, loss of interest in favorite activities. Some students turn to a hobby they love when they feel happy, but those with major depression tends to avoid it. If a student usually love sport but can't do it normally, let alone if the interest of students who have always represented the university in sport is gone. That's among the signs and symptoms of depression. Thirdly, increased energy. Ironically, when depressed, students have decided to do something drastic, such as commit suicide. They may change from slow to more energetic. That because they feel relieved after reaching a resolution. So if you notice a drastic change like this in someone you know, that's something to worry about. This can also manifest a reckless behavior, especially in men, such as engaging in substance abuse behavior, such as alcohol or drug. Fourthly, change in appetite. Some students overeat when they are depressed or anxious, but in students with severe depression, the opposite usually happens. Students who are depressed may stop eating because they no longer care about their physical health. 5. Feeling or seemingly marginalized. In most students, depression can manifest as irritability, impatience, or recklessness and anxiety. Women are very quickly exposed to the signs and symptoms of depression. This is very worrying. C. An impression of guilt. Excessive guilt can also be a feature of depression. Some students may feel guilty about themselves when they get low marks in lesson for not doing their best while studying. 7. Unexplained physical symptoms. When the body and mind are connected, depression can also begin to manifest in physical ways that are resistant to treatment, such as persistent headaches, digestive problems, or unexplained pain. Lastly, the dark side that emerges. A severely depressed student may become preoccupied with death and other confusing topics. For example, they may talk about after I go situation and may even be more likely to take uncomfortable risks such as suicide.
The factor of depression among students will be divided into three key Factors such as fatigue due to fatigue, lack of the concentration against learning, and difficulty completing assignment. On cognitive and emotion relations, that is not to be missed exactly with a deep confusion of the thoughts and emotion their lives. A problem related to academic motivation such as academic related factor, class problem, and a problem motivation.
Healthy lifestyle exercise. For students to adopt a healthy lifestyle, there are studies that have been done where most people who experience stress will tend to overeat and feel happy afterwards. However, other effect, he will get various diseases that will definitely cause healthy problem. Therefore, practice a healthy and balanced diet. Exercise at least 2 times a week. No need to do strenuous activities. Just jog, bike, or walk in the park. If you will furious and stressed, will finish your studies, take a break and do light exercise and grab healthy snack like fruits. Don't be alone. Isolating yourself while you are under stress or stress is not the right path. You need to find someone to express your feels like to or share a story with them. Maybe if you meet someone you trust and share with him, maybe you will feel clean again to think of the best solutions. If you do not have a close contact, talk to a supervisor for help. Surely a more experienced person can help you through the stress you are experiencing. Must every university also has student counseling service, so that is also an opinion for you to share with them. Get enough sleep. Make sure you have a proper sleep and rest routine to keep mental healthy, awake, and can reduce stress well. Sleep is the best way to relax physically and mentally after doing heavy tasks every day. Stress can disrupt a person's sleep maintenance. So, before bed, make sure you take a few minutes to calm down and manage yourself, like bathing and pray before bed. A body that gets enough rest will definitely feel refreshed to start any work the next day. Have a rest time. Taking a short break during work or completing assignments can reduce you to extreme stress. Also, go on the short break on the weekends by doing your favorite activities, so that your life is balanced and always energetic. Rest that guarantees quality work result.